Hello everybody, welcome back to the channel. We're doing a series of videos where we're looking at the symptoms of COVID-19 infection. We're talking about those that particularly affect people who manage to stay at home, so they have mild to moderate symptoms. In a lot of areas, hospital admission is reserved for people who either have very severe problems with breathing or respiration, and so they require oxygen support or ventilators, or they have very significant complications from the symptoms of COVID-19. Videos that we're doing are just looking at people who are advised to stay at home and use supportive care to manage their symptoms. Already in this series, we've talked about managing fever if you have the COVID-19 infection and you're staying at home, so you can check that out. I'll put that in the link below. And we've also talked about how people managing with COVID-19 at home and who have respiratory symptoms such as a dry cough, dry throat, very mild changes to their breathing can manage their symptoms at home. So make sure you check these out, and I'm going to include a link in the description for both videos below. In today's video, we're looking at how to manage another less common but recognized symptom of COVID-19 infection, which includes the effect on the bowel. In this category of illness, people might experience diarrhea, nausea, that's the feeling of wanting to vomit or to be sick, as well as vomiting and stomach cramps. So not too long after the initial outbreak of the SARS-CoV-2 virus and the infection back in December 2019 in China, it soon became apparent that we needed to consider these bowel symptoms as part of the catalogue of the COVID-19 illness. This was because they were seeing some patients who were coming in with diarrhea, nausea and vomiting, and not really so much of the other symptoms like fever or cough. When they tested these people to check for the common germs or viruses and bacteria that cause diarrheal illnesses or gastroenteritis, they weren't finding any of those. But these guys tested positive for the COVID-19 infection. So as more patients like this were detected, we realized that, well, these stomach and bowel related symptoms were associated with COVID-19 disease. In a small number of cases, for some people, the diarrhea might be the initial presenting problem before things like a fever or cough appear. In some cases reported in China, there were no coughs or fever or difficulty breathing, and it was simply the diarrheal illness that was reported in those particular people. And they described having loose stools, which is what diarrhea is, and frequent passing of loose stools. They described having loose stools occurring 3 to 4 times or more a day, associated with stomach cramps, and in some cases the feeling of being sick or wanting to vomit, and some also experienced vomiting episodes. So I might hear you asking, is it usual for you to have diarrhea in what is primarily a respiratory illness? And the answer to that is, it is not unusual. When we had the episode of the Middle East respiratory syndrome MERS, up to 30% of cases were associated or were found to have diarrhea or bowel related symptoms. And when we had the SARS, that is the severe acute respiratory syndrome episode, about 10% of people had diarrhea and other gastro or gastric symptom involvement. So now that we've established that it's not unusual, diarrhea and other bowel related problems or stomach related problems could happen with the SARS-CoV-2 infection or COVID-19 infection, how do we manage them? What do we do? Well, in the case of diarrhea and looking after this at home, the key thing is any diarrhea caused by any infection can lead to dehydration and kidney problems or kidney injury. So the principal thing is making sure the individual does not get dehydrated, which you can achieve by replacing the fluid lost from the body with water and other liquids to promote hydration. So the most important thing for people who are at home with COVID-19 infection, who are experiencing frequent passage of loose stools, is to make sure that they stay well hydrated. Like I've said, fluids like water are used for this purpose. Dilute juices like dilute blackcurrant or lemonade. There's also the oral rehydration solution, which in some areas is sold as diarrhea, or in some places is known as the salt and sugar solution. Is effective in replacing the fluids and the salt that the body loses when passing very loose amounts of stools, and doing that very frequently. So avoid drinks that are very concentrated. Orange juice, pineapple juice, no. Dairy like yogurt, no, that would irritate the already upset bowels. Avoid fizzy drinks or bubbly drinks like soft drinks like Coca-Cola or Pepsi, no, because they will just upset the tummy more and increase the process of diarrhea and contribute to more fluid loss. So stick to water, stick to oral rehydration solution, very, very dilute liquids, clear liquids like lemonade, if that's what you have at home, or blackcurrant. Mix it up with water and drink that frequently. Small amounts is usually better, so you can make up a glass or a jug. For the oral rehydration therapy, follow the directions on the sachets or the packet. They usually come as powders that you mix with particular volumes of water, so follow the advice on the packaging or speak to your medical professional about the dose that's appropriate to use. Mix if all you've got is lemonade or blackcurrant at home, mix that with water. Make sure it's not too concentrated, and that can be used. Put in a jug of water by the bed, keep sipping at it, keep taking small quantities frequently, just to help to replace any amounts that's being lost by the stool. The other bowel related problem is nausea and vomiting. So nausea and vomiting can at any point towards the early course of the illness. Usually the episode of nausea and vomiting may take a few days to settle down, but if it becomes profuse and excessive so that the individual is not able to keep any fluids down at all, then you must contact your doctor. In some cases, it may be necessary to use anti-sickness or anti-emetic medicines to control the vomiting. Or if the concern is that the individual is quite close to being dehydrated, they might need to be admitted to hospital to have intravenous fluids. And this is a similar outcome if you think that somebody has been passing loose stools very frequently, and you suspect or you're concerned that they might be getting dehydrated. So please bear this in mind, that while some of the symptoms can be managed at home, if they become worse and they become complicated and you're unable to cope with them, you must seek medical attention, seek medical advice about what to do next. The advice for what to drink with nausea or vomiting is quite similar for people who have diarrhea. Avoid anything that could further upset the tummy. By the time one is able to tolerate a fluid with vomiting, just start with very small sips of water, wet the tongue, and then after a while, if you've not been sick again, have a little or half a glass of plain water, and keep trying that every half hour or every hour. And if you're not being sick, if you're able to keep that down, you could try other liquids, tea for example, very, very dilute drinks like I've mentioned before, or oral rehydration, if you're able to keep them down. We advise people not to take high protein drinks or foods containing high protein, so just a little splash of milk if you want to have tea. Avoid dairy because that could make things worse. Again, avoid rich or spicy drinks that could further aggravate your tummy. Now, the other symptom that people may experience in the course of the diarrhea or the nausea and vomiting are abdominal cramps, similar to when you have a stomach bug, or a bit more uncomfortable than that. For people who are able to take fluids and you can swallow and keep medicine down, paracetamol has been known to help with the stomach cramps, and of course they will ease as the episodes of diarrhea and nausea end. Watch out for any severe pain in the abdomen, because that's not really been reported as one of the symptoms for the COVID-19. So we don't want to, while we're trying to manage things at home, we don't want to miss any other problems that might develop. So any severe pain that is not responding to any pain medicine, or is getting worse, or you feel it's just you can't cope with, you must contact your medical practitioner for advice. So these are some of the bowel related symptoms that we expect somebody who is managing at home with mild or moderate symptoms of the COVID-19 infection could develop. A lot of the time it's about fluid replacement, and most of the time the symptoms tend to resolve within a few days. Now, if the symptoms become worse. So vomiting persistently, not able to keep any fluids down, like I said earlier, is a risk of dehydration. So that individual needs to be seen, to be assessed. So contact your medical provider. If then the episodes of diarrhea become more frequent than when they first started, and an individual is becoming more tired and weaker, then of course they must be assessed. Please contact your medical provider as well for more guidance on how to manage this, because those kind of cases shouldn't really be managed at home. Yeah, so that's a look at the symptoms relating to the bowel. Like I said in previous videos, we've talked about how you can look after fever and what you can do about cough and respiratory symptoms, so have a look at those as well. If you found this video helpful, please put a like in the comments. Please like the video and put let me know in the comments section as well. If you have any questions, you can send a private message to us on info@askawayhealth.org. Please don't forget to subscribe to the channel and share the video as well if you found it helpful, so people can hopefully benefit from it. So we've got one of the videos, the last one actually in this particular series, that's looking at the other general symptoms that can happen for people who have the COVID-19 symptoms, mild to moderate symptoms, and looking after at home, and some of the tips that we recommend for them to help get through the period of illness. So thanks for watching, and I'll see you in the next one.